So Stephen, some people, they'll hear mHealth and baby boomers and they'll think contradiction. Could you talk a little bit about what you've seen in the mHealth space with baby boomers?
Absolutely. No, I think it's actually a perfect combination of two mega trends that we're seeing right now, which is on the one hand this sort of technology explosion, this exponential increase in new gadgets, new devices, new usability, and ubiquitous connectivity. But at the one hand, that's also meeting then this massive increase in the numbers of baby boomers. As we all know, there's 10,000 new baby boomers turning 65 every day for the next 17 years. And they're looking for new solutions. They're looking for wellness. They're looking for ways to stay active, stay healthy, and stay well. And what we're really seeing is this shift away from just thinking about later life as medical issues and thinking about negativity, and actually the whole point what we're doing with Aging 2.0 is bringing a much more positive twist, making wellness, aspirational lifestyle much more part of the conversation of what it means to be an older adult. And there's a lot of interesting new mobile health solutions out there. One of the big areas that we're seeing is smart homes, so making it possible for people to live independently, so they don't have to move into assisted living before they're ready. And that's a huge opportunity from a business perspective for them, but also from a social perspective to connect these people and avoid the social isolation. That's a real challenge in our time. So there's a number of other opportunity areas that we're seeing, many great new startups, for example, in connected care. So lots of ways in which an individual is now going to have a much more organized and coordinated care team around them, that's including the doctors and family members and caregivers, to share information and make life a lot easier for both the caregivers and the individual themselves.
Mm-hmm. Now talk a little bit about Aging 2.0, a little more about what you're doing this year.
Right, so we were here last year, 12 months ago, and it's been a pretty busy year. So in the last 18 months now, we've had 32 events around the world. So we go around, we've been in the US, Germany, and the UK, bringing together entrepreneurs, non-profits, investors, technologists, designers into this kind of collaborative groups, and then have them present their new ideas, have them pitch their ideas to the community. And what we've been doing is identifying who are the most interesting entrepreneurs around the world and creating this network. And so now we've got thousands of people on our database and some fantastic entrepreneurs. So what we've now done is sort of split a little. So we're continuing to have this global network, and we've got now tens of cities who have volunteered to run these local organizations for us. And we're now focusing more on something that we've just launched called the Generator Program, which is a founders program for the top entrepreneurs in aging. We've got 11 great companies based out of San Francisco in the Bay Area, and we're working with them for 6 months, and we're helping introduce them to customers and capital and put them together with pilots, and really sort of working closely to help a smaller number of companies really succeed in this space.
Now, mHealth really is a buzzword these days. There's a lot of new players you were mentioning. There's just more developers, more vendors. How much of the market is marketing hype? How much of it really promises to transform care?
I think that's a great question. There's this joke that goes around that there's more pilots than in the United Airlines headquarters, and there's a lot of pilots, and I've been studying this space. I was working with Vodafone 3 or 4 years ago looking at the barriers to mHealth adoption, and I just think it's one of those things that it's so exciting, there's so much potential, so it's almost that the expectations are inevitably not going to be met in the short term in terms of what the industry impact is going to be. But I think in the long term, there's no doubt that we're going to just see massive change. And I think we're starting to see some really interesting, serious business impact being made. I mean, there's a lot of capital now flowing into the health IT space in particular, which is sort of, these are venture capitalists and investors who spend a lot of time looking at this space, who've now decided that this is sort of time to move in. And obviously on the regulatory side, there's been massive movement, and there's a very dynamic phase now, and a lot of people are finally feeling that we're seeing on the one hand sort of this regulatory environment being much more open, and the political context being with people much more sort of willing to to have those hard conversations and look at the costs that we've been incurring in the US compared internationally, for example, which is some very interesting statistics about how we can get more productive, how we can get more efficiency out of our system. At the same time, technology entrepreneurs are finally coming to meet up. So we haven't had that sort of combination before of the sort of ability to get things done with also this political will. So I think it's going to be, I think it's happening in the next year or so. I think what we're seeing also is that mobile health is evolving to sort of much more than just mobile. I mean, a few years ago it was all about the mobile phones, but now it's so much more. It's so much more about the sensors around the house, or it's about this emerging concept of Internet of Things. It's sort of smart wearable devices. I think some fascinating progress happening there. And so there's going to be tests, and there's going to be a new sort of exploratory mode right now, and then something's going to hit. And I think a big opportunity, which I'm super excited about, is when we actually get this quantified self movement. When we talk about buzzwords, quantified self is right up there because it combines so many of the interesting trends, which is sort of tracking and measuring performance in one's individual statistics about life. But if you can combine that with the boomers and actually make the gadgets, the technology, the services, and the wearable devices super easy to use, automatic, invisible, but actually delivering the benefits to those who need them most. And it's not just about the 30-year-old venture capitalists in Silicon Valley who are measuring their latest performance on their bicycles, but it's people across the US and across the world who don't necessarily have great connectivity, who don't necessarily have access to doctors and access to the family members as much. But if they can start being users, consumers, and the target market of some of these products and services, I think that's where we'll see the major impact. And I think what we need to see then is the technology companies and the industry and the aging services industry to get together. And we're starting to see that, but there's still a bridge that we need to sort of create to bridge those two sides. But I think there's an opportunity to really move this away from the sort of the edge case adopter into the mainstream, and that's I'm super excited about.
Well, thank you very much, Stephen, for being with us today. We really appreciate it.
Pleasure to be here.